Hi everyone. Welcome to this lecture on the risk associated with the consumption of drugs and medicines. Throughout this session, we'll explore how the body interacts with drugs, the development and the use of medicines, and the potential risks and challenges involved. Understanding these aspects is crucial for making informed decisions about medication use and promoting overall health. I'm Madam Nurliawati from Department of Basic Science and Entrepreneurship, Center for Fundamental and Continuing Education, University Malaysia Terengganu will present this to you. Let's start by understanding the human body as a highly complex and dynamic system. It operates through a delicate balance of countless chemical reactions that adapt to our activities and environment. However, this balance is constantly challenged by factors such as genetic abnormalities, environmental influences, aging, and the infections caused by microorganisms. Maintaining this balance is key to our overall health. The human body has a remarkable defense system designed to protect us from harmful invaders. The first line of defense includes physical barriers, such as the skin and mucous membranes, which act as shields. Next is the second line of defense, where mechanisms like white blood cells, blood clotting, and inflammation work together to fight infections. Finally, the third line of defense is the immune system, which creates antibodies and memory cells, equipping the body to handle repeat invasions effectively. The body employs three lines of defense to protect against diseases. First are physical barriers like skin, mucous membranes, and natural closures such as eyelids. The second line includes internal responses like white blood cells, clotting mechanisms, and inflammation. The third line, the immune system, uses antibodies and memory cells to provide long-term immunity against specific pathogens. Pharmacology dates back to the use of natural substances like herbs for healing. Early remedies included morphine from poppies for pain relief and salicylic acid from willow bark, which inspired aspirin. These discoveries underline the importance of nature in developing effective medicines. Let's look at some historical remedies. Morphine, extracted from poppies, was widely used in the 19th century for pain relief. Quinine from the cinchona tree treated malaria. Salicylic acid, derived from willow bark, laid the groundwork for aspirin. These early treatments highlight the medicinal value of natural compounds. Modern medicinal chemists aim to design drugs that target diseases effectively with minimal side effects. Starting points for many drugs come from nature. For instance, quinine treats malaria and Gigi-toxin from foxglove supports heart function. The goal is to create selective medicines that work in specific cells while avoiding unintended effects. Cocaine from coca leaves was an effective local anesthetic in small doses, but had severe side effects like damaging the central nervous system. So scientists improved its safety by modifying its molecular structure. This process led to the concept of lead compounds, which serve as prototypes for developing better drugs with fewer side effects. Okay, so we have come to the term of medicines. Developing medicines is a complex and costly process with only a small percentage of candidate drugs making it to the market. Medicines are defined as substances that alter physiological states, emotions, or sensory experiences. Their goal is to improve health, although the use of some drugs can be controversial. Okay, so we have come to the term of medicines. Developing medicines is a complex and costly process with only a small percentage of candidate drugs making it to the market. Medicines are defined as substances that alter physiological states, emotions, or sensory experiences. Their goal is to improve health, although the use of some drugs can be controversial. Okay, now let us move on to a popular drug named paracetamol. As we all know, paracetamol is a common pain reliever. It works by blocking prostaglandins, substances responsible for pain and inflammation. However, this paracetamol has side effects like allergic reactions or in excessive doses, liver and kidney will be damaged. This illustrates the balance between effectiveness and the safety in medicine use. Now is the time for the placebo effect. The placebo effect demonstrates the power of mind body interactions. Simply taking a treatment, even if it has no active ingredients, it can trigger emotional and physiological responses that can lead to perceived improvements in health. So, this highlights the psychological dimension of healing. As for access to drugs and medicines, in most countries, they are controlled, but the definition of what constitutes a drug may vary. For examples, we have two types of almost the same drug, which is called the different name of melatonin and also the codeine 8. As for methods of administering drugs, the drugs must first enter the bloodstream to reach their target tissues. Common administration methods include oral ingestion, inhalation, topical application, injection, and rectal routes. Each method affects how quickly the drug is absorbed and how effective it is. While medicines and drugs can sometimes overlap, the distinction lies in their use. Medicines are drugs that specifically designed to treat or prevent diseases. They fall into categories such as vaccines for disease prevention, antibiotics for infections, pain relievers, and medications that can regulate body functions or restore health. Some medicines are designed to prevent diseases before they occur. Vaccines introduce a harmless agent to stimulate the immune system, leading to the production of antibodies for long-term protection. Antitoxins, on the other hand, work faster by neutralizing toxins already present in the body through injected antibodies. Certain medicines enhance overall health by addressing specific needs. Antihistamines manage allergies, while body regulating medicines such as blood pressure regulators, inhalers, and insulin support physiological balance. Antidepressants stabilize the mood, and chemotherapy drugs target cancer, helping patients maintain and restore health. Now, it's time to discuss the problems in consuming medicines. The use of medicines comes with challenges. Side effects are unintended reactions that can range from mild to severe. Tolerance occurs when the body adapts to a medicine, reducing its effectiveness over time. Withdrawal symptoms such as headaches and nausea can emerge when discontinuing a medicine after dependency develops. For medicine safety, to ensure safety, governments implement rigorous testing and approval processes for medicines. Regulatory bodies like the FDA require comprehensive data on a drug's chemical composition, intended use, and potential side effects before approving it for public use. These safeguards aim to minimize risk and maximize benefits. And in conclusion, medicines and drugs play a vital role in treating diseases and improving health, but they must be used responsibly. Understanding the balance between benefits and risk, adhering to safety protocols, and being aware of issues like side effects, tolerance, and withdrawal are key to ensuring their safe and effective use. Always consult healthcare professionals and rely on credible information when making decisions about medication. Thank you, and let's continue to prioritize health and well being in our lives.